Hello viewers, welcome back to Adorable TV channel. And today I'll be talking on good reasons why you go into nursing. If you've not subscribed, don't forget to hit the red subscribe button and then on the notification bell for more videos. Now, we know that nursing is not just a profession. It is a call or a vocation. It is also a gift. It's not something that like you can just go into and then it is a gift, it's a call. It is also an opportunity to help people through rendering of care and prevention of diseases and all that. It is also a way of developing yourself, like through the education and all that, learning the skills and then the theory aspect. So this is just what nursing is all about. And nursing is also rewarding in the sense that most times if you go into it for the good reasons, you are like fulfilled. You're fulfilled in life. Like once you know you render care, you are very, very fulfilled. And most times our reward is in heaven. So right now we are moving in straight to some of the reasons why you should go into nursing. You have to go into nursing first if you have passion for it. You can't go into nursing just because like you see people going into it, your friends are going into it. No. When you have passion for it, then you can go into nursing. Like you can do well in it, you see yourself doing like helping people, caring for people and all that. So if you just have that passion, the love for it, the love like to care, to help, then you know that you can actually be successful in nursing. The second reason is if your instinct tells you to go into nursing, like sometimes we have like good instinct. Once your instinct say, oh, you can do this, what is that? You can care for people. You know that actually when you go into nursing you will do well. You have the skills. Sometimes we even have the skills without even knowing that we have it. Sometimes we even have the ability to care but without even knowing that you have it. Once your instinct start telling you that, start messaging you that you can do it, then you can venture into it and you'll be very, very productive. Then the next reason is dreams. Like I remember when I was little, I was actually like very brilliant and all that, so I said I'll do medicine. But that same day I said I would do medicine was the day I had a dream wearing white uniform, caring for people, giving injection in the dream. I woke up, I said no, but I said I want to be a doctor, not a nurse. But I saw myself like it keep happening to me consecutively, not just once, not twice, not thrice. I kept dreaming, like seeing myself being a nurse, doing perfectly well in it. That was how I changed my mind and I decided to venture into nursing. That was how I went into nursing because of that dream, and then I know I had that passion to care and all that. So that was how my thoughts about venturing into nursing started. So if actually you see yourself in the dream, in that kind of scenario, caring for people, giving injections, serving medications and all that, then you know you can do very well in nursing. So another reason why we go into nursing is personality. Okay, your personality will tell you if you do well or not. One, you have to be compassionate. You have to be able to care for people. You have to be very, very caring. Then another thing is you have to be patient, because for you to be a successful nurse, there are some things you have to endure. It's not everything that you react to. It's not everything that like you answer to. There are some things you just endure and keep calm and do the right thing. You don't have to answer to all things. So you have to be very, very patient if you must be a nurse. Then another thing is sociable. You have to be sociable. You have to be able to like socialize with people around you, talk, cheer up people and all that. If you are antisocial, you can't be a nurse. That is the truth. if you are antisocial, you can't be a nurse. You have to be sociable for you to be a nurse, because there is some time that calls for you to make a patient laugh, to allay patient anxiety and all that. So you have to try to like crack a joke, make this patient laugh, to feel at home, to feel relaxed. So if you are not the type that love being around people, that love associating with people, then you can't be a nurse. I'm sorry, you can't be a nurse. Then the next thing is like, there's another thing under the personality aspect, like you have to be flexible, because nursing can be very, very hectic. It can be very, very demanding. So you have to be flexible. Wherever you attend to, whatever that comes up, you'll be able to adjust. So you have to be very, 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 very flexible. Then you should also have this intestinal fortitude to care for people, meaning like the zeal to help should come from within. The zeal to care should come from within. It's not something that someone will push you to do. No, you just see yourself doing it without even knowing that you are doing it. So you have to have this intestinal fortitude to care for people. Then we are moving into our next point, which is God fearing. I'm telling you, if you are not God fearing, you can't be a nurse, because there are some times that like you have to pray with your patient. Not like if like let me give an example. I remember one time I was in the ward, and then this patient came. That thing happened like I was on night duty. Unlike me, I don't sleep during night shift. I don't sleep when I'm on night shift. But that very day, what happened was so tremendous. I slept off without even knowing that I was sleeping, because I was with my phone on the hand, because then I was in the theater. So I slept off. When I was sleeping, I now had this short dream, like a patient came in, and then the patient was followed by one dressed blackish stuff I don't even understand. Like something was following the patient into that very theater. So when I saw that thing in that dream, I shouted, Jesus. Immediately I shouted it. That thing disappeared, and I woke up. So when I woke up, I started praying. All of a sudden, a woman came to deliver in the theater through cesarean section. At the end of the day, it was a very difficult delivery. It took longer than normal. The woman bled like excessively. There was a whole lot of complications in the theater. So, because we had a short prayer, because I had to tell my in charge then, so we started praying, and then after everything, thank God the woman came out alive, and the baby was also alive. So everything was successful, even though it took a longer time. But that is why I'm saying, before you be a nurse, you have to be prayerful. You have to be ready to pray. If you are not of same religion with your patient, fine. For example, if a patient is a Muslim, you can like ask the patient to pray in his or her own religion while you are there observing. You mustn't be the one to pray for the nurse. You can also, and even if the person is a Christian, you can ask the person to pray for his or herself without you being the one to pray. You have to be God fearing, because there is a lot of challenges that comes with nursing, especially when you are in the ward. There are a lot of challenges that comes with it. So if you are not God fearing, you see yourself like doing things contrary to the main reason why you were there. You see yourself giving injection and abscess is forming. You see yourself giving injection and then the person is becoming paralyzed. So nursing has ups and downs, and if you are not God fearing, you won't be able to overcome those challenges. So you have to always pray when you come to work, pray with your patient, or ask your patient to pray. You can even invite the hospital imam to pray for the patient, or a hospital priest or pastor, depending on the one you have. So you must be God fearing in order to overcome these challenges in nursing. So the next one is desire to help. If you are not ready to help, you can't be a nurse. You must be willing to help. You must have this zeal to help, because nursing is all about love and service to humanity. It's all about love and service to humanity. You must be ready to help. You must be ready to render help when the needs come. Rendering help doesn't mean you have to take your money from your pocket to buy food from the patient always, because if you do that always, definitely you are going to go bankrupt. buying food for patients in the ward. No, but this is not really what it is. Rendering help, you can render help to a patient in many ways. Like most of the aspect of nursing is all about care, help, helping a patient to bed bath, helping a patient to eat, like by feeding the patient. These are all help. There's a time that calls for you to be the one to feed the patient yourself, not calling the relative to come and feed the patient. No. These are some of the things, like you must be ready to help. That is just it. The zeal to help must be in you. Then the next one is like high IQ, like very, very, very literate. You have to be knowledgeable. You have to be literate enough. We know that before you venture into nursing, you have to at least have studied biology, chemistry, and physics. So for you to be able to venture into nursing, you must be knowledgeable in these courses. So if you're not literate enough, you won't be able to do nursing. I'm not saying that people that venture into art courses or commercial courses are like illiterate. No. But before you venture into nursing, you must be ready to study, ready to read, because nursing is a continuous process, in the sense that as you go in, you see more areas coming out in nursing that you have to venture in. You keep studying to update yourself. Nursing, you keep reading. Not just after graduating in maybe school of nursing or the university you stop reading. No, you have to keep reading to keep being updated. So if you're not the one that even love reading, I'm telling you, you can't even do nursing, because you have to keep updating yourself. So not because of this, you have to be knowledgeable enough, you have to be literate enough. So the next one is I think this is just the more like the main reason why you should go into nursing. There are so many good reasons why you should go into nursing. Remember, you can't go into nursing if you are being forced to do that. You can't go into nursing if you're going there because of the money involved, because it's very, very hectic something. Like if the passion is not there, if the ability to render care is not there, if you're not God fearing, and so on and so forth, you won't be able to like overcome the hurdles in it. So you have to be able to have this like good reasons before you venture into nursing. Okay, thanks for watching. Keep tuning in for more videos on Adorable TV, and don't forget to like, share, and comment. Thank you.